Ankle sprains are among the most common injuries to the lower extremity. These are a result of a fall or misstep during ambulation and sporting-related episodes. This injury is classically observed as an inversion injury at the ankle and subtalar joint of the foot, whereby several structures may be injured. The anterior drawer test is useful for identifying an injury to these lateral collateral ligaments. They include the anterior talofibular ligament, ATFL, the calcaneofibular ligament, and the posterior talofibular ligament. The ATFL, the most commonly injured ligament with inversion, originates from the anterior aspect of the lateral malleolus and attaches to the anterior medial aspect of the neck of the talus. Its function is to resist anterior translation and internal rotation of the talus on the tibia. The anterior talofibular ligament rupture is seen with a positive anterior drawer sign in the lateral radiographic view, whereby the talus will protrude from the ankle joint.
To perform the test, place the patient in supine. With one hand, stabilize the tibia fibula. With the other hand, grasp the posterior calcaneus and talus and translate anteriorly on the tibia fibula. It's important to place the ankle in 10 to 15 degrees of plantar flexion while applying the posterior to anterior translation to put a stress on the ATFL. The laxity of the ligaments should be graded 0 to 3, 0 being no laxity and 3 being gross laxity, and the patient's response during the test should be monitored. Hi Taylor, my name is Ross Nelson. I'm going to be your physical therapist today. So what I'm seeing is that you've had an ankle sprain, and I'm going to do a test called the anterior drawer test. And this test is going to help me assess if any of those ligaments might have been torn during that ankle sprain. So what I'd like you to do is to lay down with your head facing that way and then your leg over the towel. And I want you to let me know if you have any pain or discomfort throughout this test, okay?
Okay.
All right. So Taylor, after assessing both ankles, I found that the ligament laxity on both sides was equal, which means that the anterior drawer test was negative. This doesn't necessarily mean that you did not tear any of the ligaments that hold that ankle in place, and I will perform further testing to see for sure if there's any tears of those ligaments.